Good morning, your
Good morning.
distinguished chairman, ladies and gentlemen. I'm Bing Yang, Director of Research Center for Smart Healthcare, Tsinghua University, Deputy Director of Institute for Internet Behavior. Thank you for inviting me to attend this wonderful conference today to share our work and experience on COVID-19 control in China with our dear friends from China and Europe. Up to October 17, 2020, there are total 39 million confirmed cases and 1 million deaths reported globally. We can see from the picture that the pandemic has spread all over the world. However, we don't have very effective treatment. Vaccine is still under investigation. Therefore, it is clear that COVID-19 infection has been a serious public threat all over the world. Today, I would like to introduce our work about the COVID-19 intelligence prevention and control system. Then, I would like to share our work about National Telemedicine Team. Based on cooperation between the research institutes inside Tsinghua University and Beijing Tsinghua Chang'eng Hospital, we developed some smart systems covering family and community prevention and control in hospital process and discharge administration. On the family and community control stage, we develop self-assessment system, community monitor systems, and psychiatry self-management system. On the stage of in-hospital management, we develop systems for pre-diagnosis, smart diagnosis, smart examinations, and disinfection robot. On the discharge stage, we develop integrated caring and tracking system for discharge patients. Let me give you some detail. During COVID-19 outbreak, you can see this picture almost in every general hospital in China. A large number of patients gather in the hospital, making the limited resources of the hospital more tense. It also increases the risk of hospital infection. We developed a self-assessment system for residents and hospitals. This system was developed based on China National COVID-19 protocol. If patients shows fever, breath with difficulty, and some typical signs, we would suggest them to go to fever clinic. If patients shows a special sign, such as a heart, eye, we should suggest them to go to a special clinic. If patients shows fevers orange without any other sign, we would suggest them to stay home and keep watching. Actually, we have developed this system in 10 languages including Chinese, English, Japanese, Korean, Italian, Portuguese, Spanish, Swahili, Persian, and French. Up to now, there are 15 million users from 100 countries have visited this system. This is the workflow of prevention and control. Patient can firstly scan QR code and answer questions. The system will evaluate risk of a COVID-19 infection based on evaluation score. The app will give suggestions such as go to fever clinic, special clinic, or just stay at home. If the patient needs to go to hospitals, then the app will show the nearby hospitals on map. It will also help patients to make appointment and registration. So the hospital would know there will be someone coming on dashboard and 3D map. This is the 3D map for Tsinghua Chang'eng Hospital. On this map, you can find all the COVID-19 related events in the nearby district. We also developed a psychiatry self-management system. More than 300 psychiatrists provide consulting online, and more than 100,000 users have used these services. Next, we go to intelligence triage. We apply the self-assessment system for every patient coming to hospital and guide them how to see doctor or go back home. Intelligence diagnosis system can analyze the location, size, and other information of single or multiple lesions in the lung from CT images, and analyze the severity of the disease. Then the auxiliary diagnosis opinions are given. The key functions include diagnosis, classification, and lesions quantitation. By the means of lesion quantitation, we can tell the seriousness of the disease. This system was used in 9 hospitals in Wuhan. Sensitivity achieves 99.3%. Specificity is 90%. Positive predictive value is 96% and the negative predictive value is 93%. It is obvious that this is a well-designed and developed system. The intelligence auscultation system can help doctors in isolation ward or through remote way to carry out non-invasive rapid examination of patients. Doctors can use an electronic stethoscope to collect the patient's sounds of lung and heart and listen to them through Bluetooth headset. The system also gives auxiliary opinions on the screen. Doctor can also guide the medical staff to place the equipment remotely through video conference. Doctor can hear and give advice remotely. This system has been used in 14 hospitals in Wuhan, Tianjin, Guangzhou, and Beijing. This picture shows a disinfection robot deployed in Tsinghua Chang'an Hospital. It can carry out intelligent mobile inspection on the internal areas of the building and use the measures of the spreading disinfectant dry fog and UV for disinfection. This system integrated overall rehabilitation services, including in-hospital rehabilitation station and home recovery. Medical staff and patients are provided apps to communicate from hospital to rehabilitation station and home. For those patients who don't have a smartphone, we also provide intelligent voice services to help them to communicate with the system. By this integrated system, medical staff could arrange beds, making registration and track serious adverse events during rehabilitation station. Patients could also do self-assessment request consulting and making health report. Once being cured, patients would be sent back home. They should make self-assessment, request consulting, and request health guidance. Meanwhile, medical staff could make follow-up and online education. Up to now, this system works well and has served more than 30,000 cured patients in the 555 rehabilitation stations in Hubei province. This is the patient's app. They can use it in rehabilitation station. When they go back home, they can still use it to communicate with their family doctor. And also they can use it to manage their health by themselves. Online store has been embedded in this app. The patients can buy anything they need. Medical staff can use their app to make their job easier, such as patient registration, bed arrangement, and daily examination. We also develop a map system for different hospitals or local governments so that they can know how much work they should deal with. In order to support Wuhan to fight against COVID-19, we set up the National Telemedicine Team. In February 2020, our party of 6 went to Wuhan. We visited the major hospitals, communities, and rehabilitation stations in Wuhan to understand the actual work needs and deploy our smart systems. At the same time, we built a telemedicine network, connect tens of thousands of medical experts to provide online medical support. We set up the MIMTT telemedicine system. The picture shows how does our telemedicine system work. How does it connect patients and doctors? We get the patient's data from the systems of local hospital, then transfer to the remote medical consultation center setting in Tsinghua Chang'an Hospital. The center will invite experts from different fields in national telemedicine team, according to the frontline medical team's requirements. The medical experts can use mobile phone, pad, or laptop to connect in the MIMTT telemedicine system and communicate with each other. We stayed in Wuhan for about a month, helped a number of hospitals to establish MIMTT telemedicine system, helped the community to establish a prevention and control system, and also helped the rehabilitation station to establish integrated caring and tracking system. It was a dangerous and difficult journey, but this experience is really unforgettable. Our vision is to build up a community of common health for mankind. I hope our friends can benefit from our experience and hope this world will be peaceful soon. Thank you.